Welcome back to Get Your Man On. This is Evan Bass with Dr. Tom Alderson, urologist, incredible man, farmer, goat restorer. Random rants coming up. I've got a big one. No pun intended. Sorry. I mean, I've got a big rant. I want you to talk to me about. RANT. Thanks for joining us on this segment, Doc. We just have more to talk about. That's just all there is to it. So I have this rant. I just have to say. So there's obviously all kinds of crazy advertising stuff out there in the world for ED and low T, and it drives me nuts. I've been living in this world for a long time, trying to figure it out, get better at it, like make sure I'm accurate and clear, and all that stuff. And I hear this one that they talk about come in for your office visit and get a free Doppler ultrasound. And I'm just like, okay. And so some patients will come and be like, do I get an ultrasound? I'm like, no, Doc, can you tell me about this Doppler ultrasound? Does it matter? What does it do? Like, what the heck's the point of this Doppler ultrasound?
Well, basically, a Doppler ultrasound can tell you a couple of things. There are peak diastolic pressures and peak systolic pressures that you look at. And according to some andrology specialists, there are pressures that are defined in their protocols, which say that men will have erectile dysfunction with these certain pressures if they're not achieved. So basically all you're doing is looking at the blood flow through the cavernosal artery. Usually you have to stimulate an erection with one of the trimix or intercorporal injections in order to establish a blood flow to the penis that you can see on a Doppler study. There you can get pressures and get pictures from a Doppler sound in a flaccid penis, but what difference does it make if you've got a good blood flow in a flaccid penis or not? It's what matters is the blood flow that you get. This sustains an erection in a erect penis.
Right. So the ones I'm talking about are the ones where it's basically you put the ultrasound gel on and then you listen.
Yeah.
You listen. You don't measure anything. Yeah. You just listen. Are those any good? Are those worth anything? Like listening to the blood flow in the penis with it flaccid?
If you're insecure about your definition or your history, you could do a Doppler ultrasound, which is, it's a cheap piece of equipment that you can use, but basically it doesn't add much information to you.
But like when you're listening, so you use your ear to hear the
pulse wave,
the pulse, like to establish that you have a pulse in your penis. Like we have a pulse in our penis, or else it would fall off, right? Like it's like, yes, you have a penis.
Eventually.
There's blood flow to your penis. How can a guy, like just by listening with his ears, be like, you have decreased blood flow in your penis?
Well, I suppose if you listen to enough of them, you could say, well, it sounds like you have good blood flow to your penis and you shouldn't have erectile problems. But that's not the whole story. You have to have a pressure, intercorporal pressure, high enough to compress the emissary veins, which drain the penis where you don't have a venous leak. That's a thing called venous leak. And we had a procedure that we did for several years until we figured out it didn't do any good. We would deglove the skin of a penis like you're going to do a circumcision, and then tie off all the emissary veins as they left the corporal bodies. But in 6 months, the veins found a way to leak out of the corporal body again.
Oh, man.
So naturally, we quit doing that procedure.
Right. Leaky veins. Just tricky little buggers.
It's similar to the vacuum constrictor device. It's a device that you put around the base of the penis, which a lot of men use. You put that around the base of the penis to keep the blood in the corporal body rather than have it leak out.
Right.
It's just an artificial means of doing it.
Yeah. Yeah. I mean, I know we use those sometimes in conjunction with other things to try to just throw everything we got to get this thing to work, right? Like, have you seen much success with those?
Much success with VCDs?
Yeah.
I prefer not to use them because it looks very painful to me, and I hate to prescribe something to someone that I wouldn't prefer to use myself.
Right.
But in some people you do have to use it. The leak is so bad that you have to trap the blood in the penis.
Man, that's too bad that they had something to fix it, and then it just 6 months later, the leaky vein just found a way to keep on leaking.
That's only one of the operations that we stopped doing.
And you've done a bunch of implant surgeries, right? We talk about implants.
Quite a few.
Yeah. What was that process?
One of my favorite procedures. Where I was in my infancy in my clinical practice, I wasn't very far from Houston, Texas, so I had the opportunity to know and see and witness Brantley Scott and Peter Scardino do procedures. So I would visit over at Baylor University and observe their procedures, and I got to put in a few prostheses, and I liked it, and I met some AMS reps. Steve Wilson, he's one you've probably heard of before.
Mm-hmm.
He's one of the major operators for American Medical System. He and Dr. Delph. Steve Wilson's now sort of semi-retired, living in Palm Springs off of his penile prosthesis.
All them implants.
Prosperity. But he was quite a guy. I remember we visited his home in Arkansas. He and Barbara have a home over in Arkansas, and we went over and did some surgery with him for a prolonged weekend. And fortunately, at this place in Arkansas, you could actually scrub in and operate with the Wilsons, and his wife Barbara would make rounds in the afternoon and check on the patients, and he would get up in the morning and operate all day long, putting in prostheses. So he was one of the fathers, I guess, of penile prosthesis.
Yeah, yeah.
And then Coloplast came out. They had a competitor. The first actual penile prosthesis were done many years ago, and there was an implant of a rib bone.
No.
Well, first of all, they implanted it outside of the corporal body, and it didn't last long because it was resorbed. Resorption means it just decomposes and just reabsorbed into the body. And then they came along and put the rib bone inside the penis, and it lasted longer and gave you a better erection, but there was a problem with concealment, infection naturally, you can imagine.
Oh my God.
Then Dr. Jonas was one of the first to come around. He was one of the first rigid implant men.
My goodness, the rigid implant men. May I always be called that. Doc, we've come to the end. Thank you so much for being on the show. Folks, go to getyourmanon.com to find a clinic near you where we talk about the options that you have. Call and ask for Dr. Tom and see if he's around and you can see him as a patient, and we'll get you in. See you next week. Same time, same place. Get Your Man.